Hello, how are you today? Wash my hands really quick. My name is Alyssa. I'm going to be your student nurse. Today I'm going to do a head to toe assessment on you. I will start from your head, work my way down to your feet, just assessing everything and make sure there's nothing alarming. Um, Before I get started, can I have your first and last name?
Jack Muirhead,
And when were you born, Jack?
7198.
Okay. And I'm going to ask you a couple silly questions. What city are we in right now?
Grand Volume
Okay, good. And do you know what year it is?
2021.
Good. Okay, so I'm going to kind of get a little bit of a health history on you really quick, just ask you a few questions. Do you take any medications right now?
Nope.
Okay. Do you have any allergies?
Nope.
Okay. Have you had any past surgeries or hospitalizations?
Hernia surgery.
Okay. How long ago was that?
Um, Last July.
Okay. And no complications since then? You've had no problems with that? Okay, good. Um, do you have any diagnoses that you're aware of, like anything wrong with like big ones be like your heart, your blood pressure, your lungs, anything like that? Okay, good. Um, so now I'm gonna kind of move into my assessment. I'm gonna start at your head, like I stated, and we'll kind of work our way down. So, wash my hands one more time to take measures because you touched my face. Um, I am going to start up at your head, and I'm just going to inspect your scalp. I'm just looking to make sure there's no, like, popular in young kids feel like lice, but not suspecting that with you. You don't have any dandruff or any dry skin, which is good. While I'm up here, I'm going to feel your lymph nodes, and your lymph nodes should either be non-palpable or they should feel squishy. So, I'm going to start at the back of your head, which is your occipital. Good. And then I'm going to do post-auricular, pre-auricular, um, submandibular, your submental, and then your cervical chain. And then can you straight up your shoulders for me? And this is your supraclavicular. And your lymph nodes were not palpable, which is good. Don't see any reason for concern there. Next, I'm going to move into feeling your frontal and maxillary sinus. Right here is your frontal sinus, your maxillary sinus. Any pain when I push on there?
No.
Okay, good. And while I'm here, I'm just going to kind of inspect your ears. You don't have to push the ears. Any pain with your ears? Okay. And if I was in like a lab setting, I would check your ears with an otoscope, but I don't have one with me today. I'm also going to grab some vitals on you because I need to do that. You can use what I will grab them right now. Okay. First, I'm going to grab a pulse on you. Okay. I got your pulse rate at 76 and your respirations, which is the rate that you're breathing, at 15, which are normal for respirations is between 12 and 20, so you're in that normal range, and our normal for heart rate is between 60 and 100, so you are in the range there. Now I'm going to grab a blood pressure on you. I'm going to do a two-step process when I grab your blood pressure, but that feel okay?
Yep.
Okay. Attach this here so I. Thank you. Okay. First, I'm going to pump it up and see where your pulse stops. Okay. Now I'm going to listen with my stethoscope and grab your blood pressure, okay? Okay, I've got 110/64, which is good. Okay, now that we've done that, at this time I would also take your temperature and I would take your pulse ox, which I will assess your fingers really quick. I'm just looking for any clubbing. And there is no clubbing present. I'm going to check your cap refill. This is just making sure that oxygen is getting to your tissues. And it is less than 30 seconds, so that is good. While I'm here, I'm just going to assess your arms, looking at your skin, palpating just to make sure both arms are symmetrical and muscle mass and everything, which they are. Good. Skin temperature is good. You have a little bit of acne. Is that pretty normal for you?
Okay.
Okay, good. Next, I'm going to have you move. Do you know what like swimming is? Like front stroke, back stroke. I'm going to have you do like a front stroke with your arm, and I'm going to place my hand here to feel if you have any crepitism, which is like creaking or cracking. Okay, front stroke. That feels good. Can you do backstroke for me? Good. Okay. Can you flex your arms up like this? Any pain in the elbows? Okay, good. Now I'm going to be testing your cerebellar function. Can you go like this? Good. And can you kind of go like that? Good. Next, I'm going to have you push against my hands for resistance. Just kind of push against me. Good. Then up. Then push up. Then push down. Good. Okay. Now I'm going to move back into your face, and I am going to start with your eyes. Okay. I am going to be shining this light, and you don't have any history like migraines or anything, right? Okay. This light is just going to check to make sure your pupils dilate. So I'm just going to be shining it in each eye, okay? Okay. Good. Okay. All right. And then I'm going to have you look at my pen light and then just follow where it goes, okay? Good. Okay, that checked cranial nerves 3, 4, and 6, which was your oculomotor, your trochlear, and your abducens, which they all seem to be intact. And I'm also going to check and have you look at my pen light, and then look at the laptop behind me, and then just look at an object kind of behind me, and then look back at the pen light. Okay, your pupils will constrict when you're looking at the light, and they dilate when you look at a further object, which they accommodate. So with that, your eyes did this acronym we call PERLA, which means your pupils are equal, round, and reactive to light. Now, also with your eyes, I'm just gonna pull down and look at your sclera to make sure it's just white. Okay, and then kind of look down and find me. Good. Okay, next I am going to look at your nose, okay? I'm going to shine this light up your nose, and I'm just looking to make sure there's no polyps, anything present, and make sure your septum is intact, okay? Good. Looks good. And then while we're here, I'm going to be checking your olfactory cranial nerve. I'm going to have you close your eyes, and I'm going to put the scent underneath your nose, and I'm going to just need you to tell me what it is, okay? Oh, excuse me. Okay, do you know what it is?
Small kind of garlicky, but I know it's kind of funny.
Okay, that was good. So now I'm going to assess your facial cranial nerve. So can I have you smile for me? Can I have you frown? Can I have you puff out your cheeks like a fish? And can I have you make like a scowling face? Good. That seems to be intact. And also I'm going to have you come to feel right here and have you clench your jaw. Good. Okay, and then I'm gonna use this and I'm gonna place it on a couple different faces on your face, and I just need you to tell me where it is, okay?
Open or shut?
Your eyes can see it.
Forehead.
And now your trigeminal cranial nerve, which seems to be intact. Next, I am going to assess your mouth. So, do you have any thing removable, like retainers, crowns?
Nope.
Okay. Any pain in your mouth that's been going on? Okay, good. This, I'm just going to use my light, and I'm just going to have you open up your mouth really quick, and I'm just going to inspect the hard and soft palate, which it seems to be intact and no abnormalities there, which is good. Next, I am going to have you stick out your tongue. Okay, and can you stick out your tongue and say ah? Okay, and I'm just making sure your uvula moves up and down, and those two assessments that you just did, check your hypoglossal, your glossopharyngeal, and your vagus cranial nerves, which they all seem to be intact. Next, I am going to palpate your carotid arteries, which I don't want to palpate them at the same time. I'm just palpating them for symmetry, which is good. And that is good. I'm going to now use the bell of my stethoscope to listen for bruise, which is something we don't want to hear. It's like a swishing sound, which they're usually not present, but we just like to make sure. And I'm going to have you kind of look that way. And can you hold your breath for a minute or for a second? Good. Okay. This way. Good. Now I heard no bruise when I did that, so that is good. Let me think here before I move on. Make sure I didn't miss anything major before I have you turn around. I actually am going to move down and look at a few things on your legs, okay? I am going to, normally I'd have my reflex hammer, but because I don't have that with me today, I'm going to use my hand to check your patellar reflex. Make sure. Okay? Okay, good. Next, I'm going to have you, can you move your ankles in a circle? And then I'm going to have you press against, kind of like we did with your hands, like the resistance. Okay, good. And then press up, press down. Those ones are kind of hard to press up. Good. Okay, and I'm just, while I'm down here, I'm also looking at your legs, making sure there is no, nothing abnormal. Temperature and legs are both good. They are both symmetrical. There's no bulges or reason for concern. Um, that seems to be good. Let me check my sheet really quick before I have you turn around, and we will do more of this. Okay. One more thing before I do have you turn around. I want to look at your trachea, and I'm just going to kind of feel and make sure that it's not deviated to one side, which it isn't, so that is good. So now I can have you kind of swing around for me, and we're going to do a respiratory assessment. Yeah.
Right here.
No, swing around to your back,
Okay.
facing the camera. Okay, good. Okay, so first I'm just going to assess your back, your skin, and it does look like, again, you have some acne, but that is your normal, you said, right? Kind of get worse in the summer months.
Oh, yeah.
Yeah, okay. While I'm back here, really quick, I'm going to palpate your thyroid. I'm going to move your trachea to the side, and I'm just going to have you swallow for me. Okay, good. Other side, and I have you swallow one more time. Okay, that was okay?
Yep.
Okay, good. All right. Next, I'm going to auscultate your lungs. There's going to be a total of 12 different deep breaths I have you take. So if you need a break at all, just raise your hand and I will give you a little break, okay?
All right.
All right. All right. Can you take a deep breath for me? Take a deep breath. 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 And last one, deep breath. Okay, good. Now I'm going to percuss over your lung field. That's just like a fancy term for me tapping. And I want to hear resonance over your lungs. If I hear any dullness, that could indicate, fluid in your lungs or any masses that we need to further investigate. So I'm going to have 12 different taps. Good. And then now I'm going to check your AP to transverse ratio. I'm going to feel right here, and then I'm going to feel from your back to breastbone, and that you meet the criteria for a 2-to-1 ratio, which is good. 1-to-1 means you have a barrel chest, which we don't want to see, but you have 2-to-1, which is good. Next, I'm going to check your lungs for equal expansion, so can I just have you take a deep breath in for me? Good. Okay. Alrighty. Now I'm going to have you lay down on the bed for me. Kind of maybe put your head over here or your head this way. It really doesn't matter. I am going to now check for JVD, which I will have you turn your head that way. Oh, yep, sorry. I'll have you turn your head that way, and JVD is not present, or jugular vein extension. But if it was present, we would lift your head of the bed till 45 degrees, and if it was still present after the 45-degree mark, we would raise for concern. But you don't have any present, which is good. So now I'm going to kind of move my laptop over this way so she can see kind of better at like your heart and everything. So now I'm gonna move into listening to your heart, okay?
Okay.
The first point I'm going to listen to is your aortic valve, which is your second intercostal space right of the sternal border. Okay, I'm going to listen with my diaphragm, and then I'm going to listen with my bell to make sure there's no murmurs present. Good. And then I'm going to move to your pulmonic, which is your second intercostal space, left of the sternal border. Listen with that bell. Good. Now I'm going to move to your herbs point, which is your third intercostal space, left of the sternal border, excuse me. Good. Okay. Now I am going to move to your tricuspid valve, which is midclavicular, fourth intercostal space down. Just right in there. Good. And then I'm going to do this. Good. Now I'm going to listen to your apical pulse, which is midclavicular, fifth intercostal space down, left of the sternal border. And I'm going to listen here for a full minute once I get to 30 seconds. We got 72, which is a normal limit. And let me listen with that really quick. Okay, good. Now I'm going to move on to an abdominal assessment. I'm first going to get down and kind of inspect the abdomen. I'm looking for contour, making sure there's no abnormal bulges and everything looks symmetrical. I do note your pulsation of your aorta, which is normal. So that looks good. The next thing I'm going to do is auscultate. I'm going to listen to your GI sounds first, which I need to hear 5 gurgles in each quadrant before I can move on. I'm going to start with my diaphragm for this, and I'm going to start in the right lower quadrant. Right upper quadrant. Left upper quadrant. I heard vowel sounds in all 4 quadrants, so that is good. Now I'm going to listen to your vascular sounds in your abdomen with my bell to make sure there's no bruise. So the first spot is your aorta. Good. And then renal, renal, and then iliac. And then kind of in your like groin area, I'm gonna listen to your femoral. Good. And over here. Good. Okay. Now I'm gonna move on to percussion. And I am going to, it's like a tapping sound throughout your abdomen. I'll do a few different spots in each quadrant. I want to hear timpani, but when I get up, I'll explain. I'm going to start in the right lower quadrant, move to the right upper. When I get over the liver, it's a little more dull because it's a dense organ, which is normal. Any pain with this? Okay, good. Now, because you did have that past mesh, did you have a mesh implanted when they did the hernia repair?
Yeah.
Okay, because of that, when it comes to the palpation, I'm only going to do light palpation on you, but if you didn't have that surgery, I would do light and deep palpation. But right now, I'm just going to do light palpation. Any pain? Okay, good. Good. Alright. And kind of moving down here, I'm going to feel your brachial pulses, or not brachial, I'm sorry, your femoral pulses for symmetry. So I'm just going to kind of roll your pants down just a little to feel. And they are both symmetrical, which is good. I'm going to kind of move down here. I'm going to feel behind your knees, which is your popliteal artery for symmetry. And they are symmetrical. And then I'm going to, can you see your feet from that video? Okay. I'm going to feel your posterior tibialis for symmetry. And they're symmetrical. And then your dorsalis pedis. And also while I'm down here, I'm going to assess your cap refill, which is less than 3 seconds, so that is good. Now I'm also, while I'm down here, going to do a light and dull sensation. So this will be the sharp sensation. This will be the dull sensation. And you're going to have to tell me what part of the body I am touching, and if whether it's sharp or dull. So like thigh, shin, top of the foot, bottom of the foot. Does that make sense? Okay. Ready?
Dull thigh. Sharp shin. Dull top of the foot. Bottom of the foot. Sharp. Thigh, sharp, shin, dull, top of the foot, sharp, bottom of the foot, dull.
Okay, good. You only missed one, which that's a little bit normal. There's a certain range that we like to keep it in, so that's good. You passed. So now that I assessed your legs, I'm gonna have you kind of, I can move my laptop back to the podium over here, the thing over here. Good. And I'm gonna have you sit up really quick. Don't stand up before we put your shoes on. Do you feel dizzy at all? Okay, good. And I have the shoes right here that I'm slipping on your feet. Alright. Now I'm going to get up and we're going to walk, okay? So first I'm just going to have you stand up. Do you feel dizzy at all?
No.
Okay, good. So stand up for me. And we're going to Romberg you first. So Romberging is where you're going to stand with your shoulder width apart, arms kind of not totally at your side, kind of out a little bit, and with your eyes shut. Okay, I'm looking for any swaying, which it isn't present, which is good. that also assessed your acoustic cranial nerve, which is intact. Okay, so now we can walk safely, and what I'm going to have you do is walk to the door normally, and then when you return, walk heel to toe. And I'll kind of walk by you in case you feel lightheaded at all. Good. Now you can take a seat, and I'm just going to get your brain scale really quick. So what does in a brain scale, let me explain that first, is what the hospitals use to put their patients at a risk for pressure ulcers, also known as bed sores. And they kind of look at a few different things like nutrition, mobility, moisture, and friction shear and stuff like that. So what does your diet look like? Do you have a well-balanced diet?
Okay.
Do you eat breakfast, lunch, dinner?
Yeah.
Do you get some vegetables and fruits in there?
Yeah.
Okay. Get some good protein and everything?
Yeah.
Okay, good. And exercise-wise, do you exercise or are you moving around a lot? Okay, good. And then when I did your skin assessment, you didn't show signs of having any issues with excessive moisture. So for those reasons, I would give you a brain score of 23. And before I sign off, let me just make sure. Alright. So from your head to toe assessment today, everything checked out well. You look to be like a fairly healthy 22-year-old, so that is good. But if you do have any concerns come up, just always reach out to your primary care doctor and get those concerns checked out, okay? Do you have any other questions for me today? Good.